Hello everyone. Today we will going to discuss about external acoustic meatus and middle ear. Parts of ear: external ear, middle ear and internal ear. External ear collect and conduct the sound waves. Middle ear conduct and intensify the force of sound vibration, and internal ear concerned with conversion of sound energy into nerve energy and conveys the sense of hearing and equilibrium. External ear, it consists of two parts: auricle and external acoustic meatus. Auricle. Auricle, also called as ear pinna, it collects sound, help in sound localization, most efficient in directing high frequency sounds to the eardrum. Consists of a yellow elastic cartilage covered by skin, which is continuous with cartilage of external acoustic meatus. Auricle presents two surfaces, medial and lateral. Blood supply of pinna is by superficial temporal artery and posterior auricular artery. Nerve supply by auriculotemporal, great auricular, lesser occipital nerve. Lymphatic drainage by retroauricular, preauricular and infraauricular group of lymph nodes. Now, some details about external acoustic meatus. This external acoustic canal is S-shaped canal, conducts sound waves from the concha to tympanic membrane. 25 mm long, not a straight tube, subdivided into lateral 1/3 and medial 2/3 part. This external acoustic canal has three parts: outer, middle and inner part. Outer directed medially forward upwards, middle directed medially backward upward and inner part directed medially forward downwards. Pinna is pulled upward, backward and laterally to make it straight during examination via otoscope. Cartilaginous part is C-shaped. Gap of C is filled with fibrous tissue. Lining skin contains hair, sebaceous gland, ceruminous or wax glands. Ceruminous glands are modified sweat glands. Bony part formed by tympanic plate of temporal bone, which is C-shaped in cross section. Posterior superior part of the plate is deficient. Here the wall of the meatus is formed by a part of the squamous temporal bone. Blood supply: outer part by superficial temporal and posterior auricular arteries, and inner part by deep auricular branch of maxillary artery. Nerve supply: skin lining the anterior half supplied by auriculotemporal nerve, and skin lining the posterior half supplied by auricular branch of vagus. Now, some details about middle ear. Middle ear, part of ear which is concerned with conduction and amplification of sound vibrations directed from the ear pinna and external acoustic meatus by virtue of its contents. Walls of tympanic cavity are of surgical importance to approach middle ear. The middle ear cleft consists of tympanic cavity, eustachian tube, mastoid ear cells. Tympanic cavity, irregular ear filled space in the center of petrous part of temporal bone, lies between external auditory meatus laterally and inner ear medially. Axis of tympanic cavity lies at the intersection between two important axes: outer lateromedial between external and internal auditory canals, and the other one posterior-anteriorly between mastoid antrum and eustachian tube. Now, subdivisions of tympanic cavity. Tympanic cavity above the this diagram showing this one is tympanic membrane and this is tympanic cavity. Above the tympanic membrane, epitympanum, opposite membrane, mesotympanum, and below membrane is hypotympanum. Walls of this tympanic cavity may be considered as a box with 4 walls, a roof and a floor. Because of the convexity of the medial and lateral wall, the middle ear cavity is constricted at its center. Measurements of tympanic cavity. The width of this middle ear cavity is 2 mm at the center, 6 mm superiorly and 4 mm inferiorly. In the sagittal plane, the middle ear cleft measures about 15 mm both in vertical and horizontal directions. This tympanic cavity, you may imagine it like a box. Lateral wall, roof, floor, medial wall, posterior wall. This tympanic cavity divided into 3 compartments: epitympanum, mesotympanum and hypotympanum. This is epitympanum, mesotympanum and hypotympanum part of tympanic cavity. Walls of tympanic cavity. This tympanic cavity is surrounded by 6 walls: lateral wall, inferior wall also called the floor or the jugular wall, posterior wall, mastoid wall, superior, roof or tegment, anterior. In this diagram, anterior wall is opened up, anterior wall called as carotid wall, and medial wall called as cochlear wall. Now lateral wall in detail. In this diagram we can see this box represent tympanic cavity, and this diagram showing tympanic cavity by removing anterior wall. This is lateral wall, this is medial wall, this is roof, floor, posterior wall. So this lateral wall is partly bony, partly membranous. Upper part formed by epitympanum superiorly, middle में रहती है tympanic membrane, and in lower part hypotympanum. The lateral part, especially in this diagram we can see, this is tympanic cavity, its lateral wall, medial wall. This lateral wall, especially the tympanic membrane, is the only wall accessible to clinical examination and is the site of most middle ear pathologies. In addition, the lateral wall represents the classic entry site to the middle ear during ear surgery. This diagram showing lateral wall of middle ear viewed from medial side. In this diagram we can see this is tegmen tympani, ये tympanic membrane है, and this one is Meatus जो हम आगे अभी डिस्कस करेंगे in the topic ear ossicle. Now lateral wall. Again, the lateral in this diagram we can see this is middle ear cavity, this is external acoustic canal, and this coma-like structure is Meatus. So the lateral epitympanic wall is wedge-shaped. This pointer represent wedge-shaped sharp inferior portion, outer attic wall or scutum, which gives attachment to pars flaccida of tympanic membrane. ये जो pointer है, it gives attachment to pars flaccida of tympanic membrane, and this it is thin and easily eroded by cholesteatoma, leaving a telltale sign on a high resolution coronal CT scan. Openings are present in the bone of medial surface of lateral wall of tympanic cavity. The pituotympanic fissure is 2 mm long, which opens anteriorly just above the attachment of tympanic membrane. This is tympanic membrane, this is Meatus. The chorda tympani nerve, ये दिख रही है हमें yellow colored chorda tympani. It crosses the chorda tympani nerve, enters the medial surface of fissure through a separate anterior canalicular canal Hugner, which is sometimes confluent with the fissure. This chorda tympani reaches the posterior bony canal wall just medial to tympanic sulcus, enters the posterior canaliculus. It then runs obliquely downward medially through the posterior wall of tympanic cavity until it reaches the facial nerve. The point of entry of this chorda tympani into this is facial nerve bundle. Into this facial nerve bundle is usually at the level of inferior third of the facial canal on its anterior wall. Roof or tegment tympani or tegmental wall of this epitympanum is the tegmen tympani. It is thin bony plate that separates the middle ear space from middle cranial fossa. Roof formed by both the petrous and squamous portion of temporal bone. The petrosquamous suture line, which does not close until adult life, can provide a route of access for infection into the extradural space in children. Veins from the tympanic cavity running to the superior petrosal sinus pass through this suture line. Floor of the tympanic cavity separates the hypotympanum from the dome of jugular bulb. This is jugular bulb. It is narrow, very important retrofissure approach to middle ear. In this diagram we can see floor, and this is probe entering the floor of this tympanic cavity. At the junction of this is jugular bulb. At the junction of floor and the wall of the cavity, there is small openings that allow the entry of tympanic branch of glossopharyngeal nerve into the middle ear. Now anterior wall. Anterior wall cavity very narrow because the medial lateral wall of middle ear cavity converges anteriorly in an acute angle. The anterior wall is formed entirely from the petrous bone and can be divided into three portions: upper, lower, and middle part. The lower third consists of thin plate of bone covering the carotid artery. So in this diagram we can see upper, middle, and lower part of this anterior wall of tympanic cavity. This is opening of Eustachian tube. Anterior wall, in its third part we can see this opening of Eustachian tube, जो कि कैसी है, oval and 5/2 mm in size. Now posterior wall. This is posterior wall, wider above than below, highest wall, upper 1/3 large, present irregular opening, adductus to antrum. The posterior wall डिवाइड कर सकते हैं इसको हम अपर 1/3 लोअर 2/3 पार्ट. इनके बीच में जो बिलो द बीच में जो ओपनिंग है इसको बोलते हैं फोसा इनक्यूटस. Below the fossa inclutus and medial to the opening of chorda tympani nerve, there is this pyramid, a small hollow conical projection with its apex pointing anteriorly. This houses the stapedial muscle and tendon which insert into the posterior aspect of head of stapes. Again this diagram showing this posterior wall. This is a tympanic membrane, means this is lateral wall, this is medial wall, and this one is posterior wall. Posterior wall present three bony eminences, pyramidal, chordal and styloid eminences. These three eminences all together form called the styloid complex. Now medial wall. The medial wall separates the tympanic cavity from the internal ear. This is medial wall, this is tympanic cavity, and ये रहेगा internal ear. The promontory is a rounded elevation found in this medial wall, occupying much of center portion of medial wall. It covers part of basal coil of cochlea and usually has small grooves on its surface containing the nerves which form the tympanic plexus. Now this diagram showing the landmarks on the medial wall of middle ear. This is promontory. Sometimes the groove containing the tympanic branch of glossopharyngeal nerve may be covered by bone, thereby forming a small canal. The promontory gently inclines forward to merge with the anterior wall of tympanic cavity, but is more steeply sloped posteriorly. Behind and above the promontory is the oval window. In this diagram we can see this is medial wall, which is closed by foot plate of the stapes. Now contents of this tympanic cavity contents are 3 ossicles, 2 muscles, choroid tympani and tympanic plexus. Ossicles. This is malleus, this is incus, and this is stapes. The ossicles are semi-rigid bony chain for conducting sound. Malleus most lateral, attached to tympanic membrane, whereas stapes attached to oval window. Malleus, largest of the 3 ossicles, measuring up to 9 mm in length, comprise of head, neck, handle, anterior process, lateral process. Head lies in epitympanum, surrounded by superior ligament which run upward to the tegmen tympani. Head of malleus has a saddle-shaped facet covered by articular cartilage on its posterior medial surface to articulate with the body of incus by a saddle type of synovial joint. This is malleus, neck part of malleus, lateral process. The chorda tympani crosses the upper part of malleus handle on its medial surface above the incision of tendon of tensor tympani but below the neck of malleus. The neck of malleus connects the handle with the head, and amputation of the head by cutting through the neck leaves both chorda and tensor tympani intact. Below the neck of malleus, the bone broadens and gives rise to lateral process, anterior process, and handle. Ligaments of malleus. Ligaments are: the malleus is stabilized in place by 5 ligaments, 1 articulation, 1 tendon, and tympanic membrane. 3 of the 5 ligaments are outside the axis of rotation. They offer only a suspensory function. Ligaments are lateral suspensory ligament, superior suspensory ligament, and anterior suspensory ligament. We can see in this diagram, this one is lateral suspensory, superior suspensory, and anterior suspensory ligament. These 3 ligaments apparently do not interfere with sound transmission because of the small movements of the ossicle at their point of attachment. Another one are malleal ligament, anterior posterior malleal ligaments. This can be opened surgically to create a slit without perforating the membrane to allow prosthesis to be clamped around the malleus handle in certain type of ossicular reconstruction. On the deep medial surface of handle near its upper end is a small projection into which the tendon of tensor tympani muscle insert. Now some details about incus. Incus, trapezoidal body, short process, long process, and lenticular process. The body lies in epitympanum and has a cartilage covered facet corresponding to that on the malleus, the body of the incus suspended by superior inguinal ligament that is attached to the tensor tympani. Ligaments of incus are superior inguinal and posterior inguinal ligament. The incus has the least number of ligaments and is therefore more susceptible to traumatic dislocation compared to other ossicle. Stapes, smallest bone, consists of head, neck and crura part. The stapedius tendon insert into posterior part of neck. The two crura arise from broader lower part of neck and the anterior crura is thinner than the posterior. Average dimension of foot plate are 3 mm long, 1.4 mm wide, and it lies in oval window. Joints of ossicle are incedo-malleolar, saddle variety joint, and incedo-stapedial, ball and socket variety of joint. Now, some details about muscles of middle ear. Tensor tympani and stapedius. Both act simultaneously to damp down the intensity of high-pitched sound waves and thus protect the internal ear. Stapedius arises from the wall of conical cavity within the pyramid as well as from the downward curved continuation of the canal in front of descending portion of facial nerve. This stapedius, a slender tendon, emerges from apex of pyramid and inserted into the stapes. The muscle is supplied by a small branch of facial nerve. In this diagram we can see this is stapedius and this is tensor tympani. Now next muscle is tensor tympani, arises from the wall of the bony canal lying above the Stichian tube. Parts of it also arise from cartilaginous portion of the Stichian tube and the spine of sphenoid. The muscle then passes backward into the tympanic cavity where it lies on the medial wall a little below the level of facial nerve supplied by nerve to medial pterygoid. The body covering of the canal is often deficient in its tympanic segment where the muscle is replaced by a slender tendon. This enters the processus cochleoformis where it is held down by a transverse tendon as it turns through a right angle to pass laterally and insert into the medial aspect of upper end of handle of malleus. Arterial supply of middle ear by anterior tympanic branch of maxillary artery and posterior tympanic branch of the stylomastoid branch of posterior auricular artery. Venous drainage from superior petrosal sinus and pterygoid plexus of vein. Lymphatic drainage by lymphatics pass to the preauricular retroauricular lymph node. Nerve supply by tympanic plexus which lies over the promontory. Plexus formed by tympanic branch of glossopharyngeal nerve and superior inferior carotid-tympanic nerves. Now, some applied aspect of middle ear and external acoustic meatus. Fracture of the middle cranial fossa breaks the roof, rupture the membrane and thus cause bleeding through the ear. Chronic suppurative otitis media CSOM, a long-standing infection of a part or whole of the middle ear cleft characterized by continuous or intermittent discharge through a persistent tympanic membrane perforation. This is atresia of external acoustic canal, microsia with atresia, ear wax, collection of sebum, ceruminous gland secretion. Boxer's ear appears pale due to loss of blood and cartilage death and scarring. Cholesteatoma, abnormal non-cancerous skin growth that can develop in the middle ear behind the eardrum. It may be a birth defect but it's most commonly caused by repeated middle ear infection. A cholesteatoma often develops as a cyst or sac that shed layers of old skin. Cholesteatoma. Otosclerosis is a condition that affects the tiny middle ear bone known as stapes. This is stapes. The stapes can become stuck, limiting its ability to vibrate. These vibrations are crucial for hearing. The condition may be surgically corrected by putting a prosthesis. So this is about autosclerosis. Now next is hyperacusis due to paralysis of stapedius muscle. Movement of stapes are damped, so sound get distorted and get too high in volume. So this is all about external acoustic meatus, pedalier and applied. Hope you find this interesting. Thank you.